well, welcome to this video overview. We're going to be talking today about continuous quality improvement and how to use ROMA for this continuous quality improvement cycle. This is part of the ROMA Next Generation training series, which includes segments on local theories of change, understanding community level work, data and analysis, as well as implementing ROMA. So this is part of a larger curriculum as well as a larger training series. And our presenters today will be talking about how it connects into the larger training. We have Barbara Mooney, who is the director of the Association of Nationally Certified ROMA Trainers, as well as Carey Gibson, who is a project manager with the Association of Nationally Certified ROMA Trainers. So Barbara, I'll go ahead and hand it over to you.
Thanks, Courtney. We're going to talk today a little bit about continuous quality improvement. We're going to look at the ongoing cycle of CQI. We're going to think about asking questions, gathering data, and describing your current circumstance. Part of that description involves using measurement tools and turning the data that you collect into information. And then we're going to get you to think about your agency's readiness for change, because when we talk about improvement, that assumes that we're going to make a change. And then finally, we're going to talk about making a plan and how that plan might work for you as you go forward. What is continuous quality improvement? It's something that works within the larger framework of performance management, and it really looks at the implementation of the programs and trying to determine if the organization has accomplished its goals. Was it successful? Did it really help to move people or families out of poverty? Did it make any changes in the communities where low-income people live? And so it's really about doing things better. And in order to do that, you need to be able to see how you could collect the data that is a part of your performance and use it to make decisions. And that will help you to gradually improve your program processes. You see a little graphic here on the left of the slide. The little words are plan, do, check, and act. And it's really one of many quality improvement cycles. You can find them in Lean and Sigma 6 and other systems that results-based accountability, where they actually get you to think about performance evaluation that's based on data collection. It should look familiar. It should look like the ROMA cycle, which is about finding out where you are and then actually implementing your services and strategies and then evaluating them, thinking about them as you go forward. All of these concepts are based on a principle that there's an opportunity for ongoing improvement, and that every process and every occasion could be improved. There could be some improvement. And so we want to think about how improvement happens. Now, we know that this ROMA cycle, it looks like a clockwise set of steps, but we know that it isn't only clockwise, that it can also be done counterclockwise. You might go from planning back to assessment to find out some additional things before you plan. As you're implementing, you might need to go back to planning to figure out why did you plan it this way, or do you have the resources that you thought you would, and if not, how do you have to change your plan? But not only clockwise and counterclockwise, but there's also connections between the various pieces of the cycle. So while you're in implementation, you might ask more questions that would cause you to have to do assessment. And so while some other quality improvement cycles are not as complex as this, the ROMA cycle really gives us an opportunity to think about how the pieces of the activities in the performance management process work together to create the opportunities for improvement. As I said, there's an assumption that there's always something that can be improved. But what is that something? And how do you know what needs to be changed? That's the big question in the quality improvement. And what the question is how can you assess the situation to be able to identify and describe what's happening now so that you can understand what needs to change? You can't say what needs to change until you know what's happening now. Carey, would you like to talk a little bit about assessment?
Yes, I would love to. Let me start my video back up here. Thank you. So as Barbara said, first we start, of course, with assessment. So this phase, we're really doing that information gathering. We're gathering our data. We're asking questions. We're trying to determine how best to describe what it is that is happening now, or perhaps what's not happening now. So when we start this process, and really I think you'll hear us say several times, is this whole idea of continuous quality improvement is really just a series of asking questions. What are we doing? What could we do differently? What might work better? So when we think about this series of questions, first we think about the services that we're providing. What's the impact of what we're doing? And so when we think about being able to answer these questions, you might want to keep in mind who's going to have insight into answering these. So perhaps you might not be able to do it on your own, but who else in the agency would have some insight? Who else might have access to a set of data that you need to be able to make these decisions and understand what's currently happening? How might the people with the data and the people with the insight, if those two aren't the same thing, or 3 or 4 folks aren't the same thing, could you bring all those folks together? And then when does the analysis actually happen? So an element of frequency here in terms of thinking about how often these different pieces are going to be brought together. So not only are we asking questions about services, we're also asking a series of questions related to your own internal agency capacity. So thinking about again, who has some information that could help us with these people, with these pieces. So looking at the services we provide, what happened as a result. Now we're thinking about our own agency capacity. Do we have the right processes in place? How do we ensure that there's a checks and balances system? How frequently is this data getting collected? Do we have the right people with the right skill set? So really looking at agency capacity as part of that assessment phase as well. So essentially, and you may have seen this before, we're really talking about this idea of making sure that everyone involved, people on the team, the quality improvement team, stakeholders, everyone across the board, really making sure that they have enough data to understand the full situation. So not just, oh, I understand what's happening over here, or I understand what's happening, in my area, but really being able to have all of this data to be able to understand the full picture. So in this case, really making sure that there's enough data present to understand that this team is looking at an elephant. If we're not assessing and understanding the full situation, then our decisions that we make just based on that one little subset of data that we have could end up being wrong and could end up doing harm. So it's important that we're getting that full, complete picture as we gather our data. So that moves us into thinking about, well, what do we need to be able to understand that full picture? How do we understand what it is that we're looking at in totality? And so that gets us to looking at, do we have good quality data? Do we have the right data? Are we trusting that the information, or rather the data that we do have, do we trust that that is what we need? So is it complete? Is all of the information gathered at the point of intake consider that as an example. Or all the demographic elements entered? Do we have, you know, processes in place to make sure that we're not missing pieces so that we don't have to go back and try to recreate? Is the data that we have timely? So this is so important. Yes, we're all very busy. We're doing multiple things, pulled in multiple different directions, but we want to make sure that there's some process in place to ensure that we're entering data into a system either at the time of the encounter or at least having some sort of formalized structure in place to be able to make sure that the data we do have is being entered or collected timely so that we can make good use of it when we need it. We also need to make sure that our data is reliable. So an element of consistency here. Is there an ability to say, yes, this has been verified. We know that we can rely, we can trust in what this data is telling us. And again, is it accurate? So is the data entered, does it represent what is actually happening? Is it a true representation of what you need? And so, of course, if we want to have that good data, we need to make sure that we have good measurement tools in place. So those things that we're using to prove that we've rendered a service or to prove that an outcome has been achieved, we need to make sure that we've got those correct tools in place. So thinking about what do we need to make sure that we have in place to identify the output. How many are we serving? Who are they? Again, those demographic pieces. What are these folks getting? What's their frequency? Think about that in terms of a dosage. So making sure before that service is rendered that that measurement tool is identified. Otherwise, again, we've got to go back. We've got to try to recreate what we did, and that sets us up to not have that good, accurate, reliable, timely, correct data that we need. We also need to make sure that we've got those outcome measurement tools in place. So can we measure what's happened? So what? We say that all the time, the so what. So we provided a service, we measured that we provided that service, we can prove it, but do we have the proof that we need to show that there's actually been a change? So thinking about those family changes, changes in knowledge and behavior, in skills, looking at a change in status, moving from one condition to the next. So really making sure that we've got those processes in place beforehand so that when the outcome is achieved, we know what we need to collect as the proof. So of course, we know that good data relies on those good measurement practices. So thinking about how are we going to collect that data? So not just knowing the measurement tool, but how are we going to administer that tool? How frequently do we need to collect the tool to have that evidence? Where are we going to store the data? What does that look like? Who's going to be able to then have access to that data? Who's the person that does all of this? So it's not just enough to say, well, here's our measurement tool. We also have to take that a step further to make sure that we have these practices, these processes clearly defined so that everyone understands the role that they play in collecting and storing and being able to have that data. So we're talking a lot about collecting data, but we've got to make sure that the data that we have is useful. We don't want to drown in the data. We've heard this phrase before, analysis paralysis. We don't want to get so much data at our disposal that we just don't even know what to do with it. It overwhelms us to the point that we just freeze and we don't do anything. So having too much data can really hamper our understanding of getting that full picture of that elephant. We don't want to find ourselves being led in a direction that we don't necessarily need to be going down. So making sure, again, that we've got the right data to be able to make these good decisions. And remember that our data is only as valuable as the insights that we are able to draw from it. Of course, we talk about raw data is not information. We have to analyze that data in order to be able to turn it into that information that we need, and we need to make sure that we've got the right data to be able to do that. So essentially, we're thinking about this idea of this funnel. We take all of these facts and figures, we put it in our funnel, and that's the process of being able to turn that into actual information. So as we start to ask those series of questions that we presented to you earlier, we're thinking about the conclusions that we're drawing from those pieces of data. We're thinking about, oh gosh, does this confirm what I thought? Or maybe it tells me something that I hadn't quite thought of before. So the goal of this analysis process is really to be able to interpret the data at a deeper level. We're looking for those findings so that we can start to make some actionable recommendations. So once we've turned this data into our information for decision making, then we have to be prepared to be ready to hear what it tells us, if you will. So when we analyze our data, when we start to get into this process, it's bound to reveal stuff that we may have thought, oh gosh, we didn't realize that was going to happen. We didn't realize that was going to be the case. And so as you start that process, you may realize that now, oh gosh, I've got to do something differently. There's some changes that have to be made. So Barbara's going to pick up and talk to us about what that might look like.
Thanks, Carey. I did want to say that this overview is connected to several PowerPoint presentations and other recordings that are posted on the partnership's website. So talking about data, collection of data, that's one of the early ROMA Next Generation curriculum packages that we have. We have a new one that's about measurement tools, thinking about measurement tools and trying to identify what tools that you are using now to measure things. So those are all pieces that would be helpful for you, and you'll be able to draw those down in PowerPoint format with a trainer manual to help you put through these programs, this training at your own agency. So once you start to think about, once you've identified the situation, you think about what you might want to change, you really need to think about readiness for change. You really want to think about how change can happen at your agency. And even with strong leadership, it doesn't mean that everyone in the agency is going to be ready to participate in quality improvement efforts. Remember, sometimes prior efforts might not have worked well, and so people have a memory of that, and they are hesitant to start again. There are various kinds of system factors. And so what we thought would be useful, and we've tried this out with several groups, and we're getting some positive feedback that it is useful to think about agency readiness. And we say that only about 20% of people in general, when faced with a change, are actually ready for a change. 40% of the population don't acknowledge there is a problem. 40% is aware of the problem, but they aren't ready to act. And only 20% are aware and they're ready to act or they're starting to act. And I think that's important for us to understand so that we're not frustrated by the fact that not everybody thinks that whatever we have identified as our improvement project needs to be changed. This is typical stages of change, and we're going to talk a little bit about these stages today, but also know that there's an activity that you can do to help understand the agency's stages of change, where the agency might be in terms of different things like needs assessments, like strategic planning processes, like follow-up or data collection processes. So on the extreme left there, you see pre-contemplation, and that's where it says at the bottom, no, denial. That's the point at which folks are saying, there's nothing that needs to change. What we're doing is just fine the way it is. The next phase, contemplation, is a maybe phase where people are saying, well, I don't know. You see the little guy scratching his head saying, maybe things could be better. And yeah, that's possible. You know, okay, I'll think about it. But it's in the preparation phase, that next phase, where that 20% is thinking about action. They're ready for action. They're researching the situation. They're trying to think of alternative ways for things to happen. And so that's the phase at which you can help. If your agency is at that phase, then that's the place where you can start to talk about planning for new things. Then you move into the action phase, where you're actually doing something, where you're starting to make the changes. You've got your plan, you're putting it into action. Now, it doesn't just stop there, because you have to maintain that change. You know for yourself, if you want to change a behavior, the first couple of days that you change the behavior, you say, oh, this is easy. But then you experience something and you use the old behavior. You respond with the old behavior because it's more natural. So maintenance of the new behavior really takes some support. And this is an area where you have to understand the breadth and depth of support that's needed to maintain a new change. You have to do constant follow-up. You have to be there to be able to answer questions when people have questions. And then don't forget the relapse phase. When you do respond to something using the old behaviors, sometimes people have a tendency to say, well, that didn't work. We'll just scrap that new idea. And that's natural. That's normal. And as a change agent in your agency trying to do improvement, you have to be ready for that phase. And you have to be ready to say, what can we do to get you back on action? What can we do to get you back into actually using that new strategies that we thought about? So what's useful about these stages, about identifying these stages, is to really be able to think about what's the approach, what's our approach, what could we be doing as change agents to help to move the process forward and to actually see the improvement take hold. And so being able to identify the situation, just like Carey talked about earlier, identifying the situation that needs to be changed. If you also are able to identify where the agency is at a current time in regards to their willingness to change, then you can help to intercede. When you think about agency change, you're thinking about what's in your power to change. What programs are essential to agency functioning, what staff skills would be needed, what in the past has helped, has worked, what's been hard, what was easy, who has helped to make the change, and what else was there that helped, and what resources were needed. So if you see things that didn't work in the past, you can identify the barriers and then perhaps avoid them. So you want to think about what's in your power to change and what's the past experience been. And so we know that the agency, for any change to happen, the agency must be ready, willing, and able. And so that able piece allows you to think about the specific kinds of skills that staff might need. Do they need new skills? What is it that might be different? If you're talking about all these different things on this slide, about data, analyzing data, using data, communicating it, and then putting things into action, what are the specific skills that are required? And do staff already have those skills, or do you need to have some training to help improve those skills so they're ready? So then after you've thought about that, you might be able to consider agency change. So Carey, you're up next.
Great, thank you. So yes, as Barbara said, it's not just this series of looking at the data, coming up with these informed decisions because of that data. But it's also, when we're ready to start looking at continuous quality improvement, it's also important, as Barbara stressed, to understand where the people in your organization are in terms of their readiness and willingness to embrace change. So once you've considered that as part of your assessment, so not just looking at the data, but looking at the organization's change readiness, where do you start? What do you pick to start working on? Do you start with something easy? Do you start with something small? Do you start with something that you feel has a sense of urgency to it? So taking into account where the folks are on your team in terms of their readiness for change, and looking at those pieces, you're ready to start moving to think about what are we going to do next. So that actually moves us into thinking about creating a plan for change. So again, we're using this data that we've analyzed, we've turned it into information, and now we are ready to start to create a plan based off of that information that we have identified. So as Barbara said, there's a longer, more in-depth series that talks about creating these plans, one that we call a pathways plan, so thinking about the agency's use of this document that you see here. So this is taking those ideas that we have about what needs to change and putting some actionable steps in place. So remembering that we can't rely on magic to be able to bring about these improvements or bring about these changes. So we have this worksheet that you can start to think about what are those concrete steps. First I do this, then I do this, and then next I'll do this. Thinking about who needs to be involved. When do we think we might have this completed by? Remember, what gets measured is what gets done. So making sure there's enough time to actually allow for the work, but not so open-ended that there's no real sense of accountability or urgency there. So just, again, thinking about how to put these pieces together so we've got this roadmap, if you will. So just remembering, as Barbara underscored earlier in our time together, it's this idea, continuous quality improvement, the emphasis on the continuous. We have to constantly be thinking about, are we assessing what's happening now? As we're creating our plans, do we reveal something new? You know, seeing how these pieces are interconnected. We need to be able to report on what's working and also be able to report on what's not working and realize that sometimes what we do does not yield the result that we had hoped for. So what do we need to do to change? What information do we need to understand maybe where we got off base here? So what are those new data points that we need to collect? And then constantly reassessing, what do I need to do next? What do I need to do next? How does this all work together? So when we think about putting those pieces together in that sort of process, we're really looking at this idea of inputs and outcomes. So our current agency knowledge, what do we know, those data sets, that readiness for change, and then that plan for change, and then all of that contributes to this improved agency capacity, which we ultimately know is where we're working to be able to have that impact, to improve the outcomes for the families that we work with and the communities that we serve. So that brings us to the end of our presentation. And if you have questions, if you need any further information, you see the contact information here on the screen. And so, Barbara, do you have anything else that you would like to add, or Courtney?
Thank you for your attention as a brief overview of complicated issues, but I think that we can break them down so that they're easy for you to apply, so that we can be known in our network as the network that embraces continuous quality improvement.
All right. Thank you, Carey and Barbara, and make sure you all check out the additional tools and resources that go along with this training series.